I'm Dr. Anna Lothian, board-certified rheumatologist who practices in an integrative fashion. Welcome to my YouTube page. With this first official video, I wanted to introduce myself, tell you more about me, tell you more about the field of rheumatology and my mission. So, rheumatology is a subspecialty of internal medicine that, contrary to popular belief, is actually a very vast field. So the meaning of rheuma in Latin is flowing current, and the suffix ology is the study of. So rheumatology is a vast field that encompasses conditions that are simple, like musculoskeletal stuff, including tendons and ligaments and bones. Things like trigger fingers, carpal tunnel, plantar fasciitis, tendinitis, bursitis. We also treat a variety of conditions like osteoporosis, osteoarthritis, and then the exciting field of rheumatology contains the systemic autoimmune and rheumatologic conditions. These include things like rheumatoid arthritis, lupus, psoriatic arthritis, vasculitis, ankylosing spondylitis. The list goes on and on. There's another subgroup of conditions called the autoinflammatory syndromes. An example of this is familial Mediterranean fever, but there are countless conditions in that particular subset. And lastly, some rheumatologists actually treat connective tissue disorders like Ehlers-Danlos syndrome and Marfan syndrome. So that is everything that rheumatology treats. I have definitely not included every single thing on this list, but it's a vast field and it's a beautiful field and it's an ever-evolving field. And there aren't that many of us to serve the population of patients that need us, the population of patients that have autoimmune disease and have ailments having to do with the joints and the bones. The next thing I wanted to tell you a little bit more about is just a little bit more about myself. I have known that I wanted to be a doctor ever since I was a little girl. I was around 4 years old from what I can remember. At the time, I thought I wanted to be a pediatrician because at the tender age of 4, I loved kids. And, ever since I could remember, I remember feeling like the body had the innate ability to heal itself. And so prior to doing medical school, I did a master's in physiology and complementary and alternative medicine at Georgetown University. That was one of the best years of my life, especially education-wise, but also personal development. And after that, I decided to do osteopathic medical school. Osteopathy and osteopathic medical school is very similar to the traditional allopathic model, but it surrounds itself on the concept that the body, mind, and spirit are interconnected. And when there's an imbalance of one of these areas, that it can actually affect the other areas. In addition, osteopathic medical students do a deeper or have a completely different curriculum as it pertains to hands-on medicine. This is called OMT, or osteopathic manipulative medicine, or osteopathic manipulative treatments. And this is actually hands-on body work that we are trained in. A lot of osteopaths include that in their practice after, and unfortunately some don't, but this is a beautiful field that we actually are exposed to in training, and it teaches us that the body and the connections in the body have so much to do with overall health and wellness. So after I did osteopathic medical school, I did my internal medicine residency, and I actually didn't even realize that I liked rheumatology until I did an away rotation, because that's what my residency program offered. So I did my first away rotation. I really enjoyed it, but I wasn't sure if I enjoyed it just as a rotation for the month, or if this was something that I could see myself doing for the rest of my career. And so I went back and did a second rotation, and this is technically called the audition rotation, where you are auditioning for a possibility in getting into the fellowship. And I really enjoyed the second rotation. I loved the fact that I talked to patients as an investigator. Often rheumatologists are called at the tail end of a patient's hospital admission when all the other specialists can't figure something out. And I remember getting some feedback from my attendings at the time that I had the personality to fit the field of rheumatology, and they really encouraged me to apply. And actually, that is when I first considered doing so. So I decided fairly late in the game. I ended up applying to fellowship, getting into Loma Linda University, and that's where I did my rheumatology fellowship and loved it. There was a vast variety of patients, of pathology, and it was a perfect place to train for me. Since fellowship, I have been in a private practice setting. I actually started my own clinic about 3 years ago exactly in Glendale, California. The name of my clinic is The Healing Room, and it is thriving and lovely, and I enjoy coming to work every single day. So a little bit more about my mission. My mission is to treat each person as a whole. I spend a lot of time with my patients. I educate, I empower patients, because I'm a firm believer that while I diagnose and treat using the foundations of Western medicine, that the intersection between Western and complementary and alternative, evidence-based complementary and alternative modalities is where it's at. That is where the patients get the most bang for their buck. That is where they improve and see much bigger gains and feel much, much better by doing this. I also focus a lot on lifestyle modalities and lifestyle interventions. Anyway, so I hope to empower and educate you in my YouTube page. I will be posting a lot of educational content, so please subscribe, like, share, and engage in my journey. I will see you again soon. Take care.